or empathy, but obviously I was wrong there. So thank you for that contribution.
Hello. I am a hospital campaigner for Save Charing Cross, Hammersmith, Ealing and so on. We've met a few times. I've got a child who's on their second kidney transplant, and I live 14 years of the nightmare. I've now got another child with type 1 diabetes, so I live a lot on my nerves, I will be honest. Probably need the mental health care more than anyone else sometimes. We get asked, I've spoken to thousands of people along with my fellow campaigners here. We get asked constantly, is Charing Cross going to be saved? Please, we need definitive answers so we can give hope. You've asked us to go out, give hope. Can we give hope?
Well, that's a really important, that's a good question. And I wanted to pay tribute tonight because your campaign has been amazing. I've seen the way that the energy, the passion that you've put into it, all of you. Really inspirational, really inspirational. West London has become the front line, really, hasn't it, in the fight for the NHS. It really has, given the brutality of some of the cuts that you're facing here, the kind of changes that have been railroaded through. And I think he's arrived, isn't Andy Slaughter? You have of a champion who has led that fight, and we're all behind him. I mean, this is what they've been doing, isn't it? They've been just railroading these things through, and look at Lewisham as well. Look at what they tried to do there, and it's great to see Lewisham campaigns, Joss and others who were involved in that fight there. That really, I mean, what's happened here and what happened in Lewisham should send a shiver down the spine of any community in the country, that they feel they are so arrogant that they just feel they can just go in and just take away a service from a community like that. Really appalling. So to then answer your question, I've said in the Commons a few times in response to questions that Andy has raised, I mean, I believe that this plan was drawn up in different circumstances. There is a new reality in the NHS, and that reality is A&E is under intolerable pressure. Hospitals are at their limits, and I think you know that here better than probably anybody else in the country. They cannot absorb any more pressure. The fact that you've never met, this trust here has never met the government's lowered A&E target, that says it all, doesn't it? And they want to close more, they want to cut more services, when that is what is happening here. The commitment I'll give you this evening is we will call an immediate halt to this review. We will call a halt to the review. It's never right that politicians say we will decide purely for political reasons where services should go. There has to be a new clinical review of what has been happening here. But to give you some reassurance, I can say this: it cannot make sense to close A&Es in the middle of an A&E crisis. How can that make any sense? We cannot go on with A&Es across West London literally packed to the rafters, with patient safety being put at risk. The campaign you've run is inspirational, that you've all done together. We will call that immediate halt, and I would be minded not to proceed with those changes. But I have to say it would still have to be subject to a clinical review, because I can't just say whatever I've got to look at what the evidence is saying. But my view is the evidence is saying it would be unsafe to proceed with those changes, and that the programme should be stopped at this point. So, but we will work with you all on that, and we will make sure that things are done in the proper way. I mean, the lack of consultation, the way they've handled this, the way you've been treated actually by the NHS here is quite shocking actually. If you look in the NHS Constitution, it does say, as Claire says, the NHS belongs to the people. It also says communities have the right to be properly consulted and involved in any decisions about health provision in their community. Well, I'm afraid they have fallen far, far short of those standards laid out in the NHS Constitution. You keep the fight going. Your fight is a good fight. You're fighting not just for people here, though. I think you're fighting for people everywhere across the country. And with a fight like yours, I have no doubt that you will eventually prevail.
Okay, right, I think we've got about 20 minutes.